As an emerging economy, Kenya is experiencing an epidemiological transition. For a long time, our greatest health burden has been infectious or communicable diseases. In the age of today, the burden of non-communicable diseases such as cancer, diabetes, cardiovascular diseases, chronic respiratory conditions, etc., is on the rise. Add to that emerging epidemics and pandemics, and we find ourselves at crossroads of a triple disease burden. Among non-communicable diseases, cancer has become one of the key public health challenges of our times, causing undue suffering, emotional trauma, and financial burden to our people. Cancer is the third leading cause of death in the country after infectious and cardiovascular diseases, with an annual incidence of over 47,000 cases and 32,000 deaths. And with the various types of cancer, breast cancer, with some 5,900 new cases reported annually, is the leading cancer in the country. It accounts for 12.5% of all cancer cases and 20.9% of cancers among women. Of greater concern is the fact that awareness on early detection of breast cancer and uptake of screening services remain low. Only 25% of women aged 15 to 49 years have performed a self-breast examination, while 14% have had a clinical breast examination. Ladies and gentlemen, to respond to these challenges of cancer, the Ministry has in the recent past made strategic investments to strengthen cancer prevention, treatment and management in our public hospitals across the country, including our national referral hospitals. The recent launch of the Kenyatta University Teaching, Referral and Research Hospital as a Cancer Center of Excellence will go a long way in facilitating patients' access for early diagnosis and prompt care. In particular, the ongoing establishment of a molecular imaging center is a most welcome move, as it will enable cancer patients access affordable, high-quality services such as PET scans without having to travel outside the country. The Moi Teaching and Referral Hospital in Eldoret is building and equipping a radiotherapy facility which will offer services to the public before the end of this year. This will improve access to comprehensive care, cancer care, for cancer patients in the western part of this country. As the CEO said, Kenyatta National Hospital will also soon unveil its new state-of-art cancer center with plans to equip it with a CT simulator. The launch of the Breast Cancer Awareness Month today therefore comes at an appropriate time, as it coincides with the fruition of state-of-art cancer care services to be offered. These milestones demonstrate the government's commitment in the fight against cancer. Breast cancer is associated with a good prognosis where screening and early detection programs exist and timely treatment services are provided. In Kenya, however, uptake of breast cancer screening services remains low, as stated earlier. The Ministry has just concluded a successful breast health awareness and screening pilot, whose findings will inform the development of an action plan for scaling up breast cancer screening. The need for sustained advocacy, awareness, and community sensitization were identified as key strategies for mobilizing an effective nationwide prevention and control of breast cancer. It is my sincere hope that these activities will influence behavior change to allow for early detection of cancers through screening towards achieving prevention. As I conclude, I would like to urge our healthcare workers to resume screening activities while observing COVID-19 prevention measures. Likewise, I call upon our women to practice monthly breast self-examination and attend breast cancer screening at their nearest health facilities. I encourage all our stakeholders to prioritize breast cancer prevention, early diagnosis and treatment, and join the government in the fight against breast cancer in Kenya. Together, we will work towards a harmonized cancer control framework backed by a strengthened health system against cancer. Switching gears now to COVID-19 pandemic, you are all aware that some of our children are now back in school. This is in accordance with the guidelines set by both the Ministry of Education and the protocols issued by the Ministry of Health. I want to appeal to all Kenyans to be more vigilant now more than ever before, so that we can safeguard our children from any infections. Those in the transport sector that are ferrying passengers, our children included, must ensure you maintain high standards of hygiene as well as adhere strictly to the containment measures. Public service vehicles must not overload, as this would be a sure way of spreading the virus. Whereas there is no cause for any alarm yet, it is important to strictly observe the containment measures to forestall any spread of the virus. If we fail to adhere to the measures, we shall have ourselves to blame in the event of any spike, as it will mean we shall go back to where we started. We are also making a special appeal to our teachers in schools to ensure that the agreed guidelines and protocols are followed to the letter. This is the only way to ensure we continue to safely keep our children in schools. As His Excellency the President recently said, we cannot afford to gamble with the lives of our children. Therefore, let's all do our part and ensure our children learn in a safe environment. Turning now to the COVID statistics, today we report 318 people who have tested positive for the virus after testing a sample size of 2,592 over the past 24 hours. This now brings to 41,937 the number of confirmed positive cases in the country. Our cumulative tests now stand at 595,791. From these 318 cases, 309 are Kenyans, 9 are foreigners, 215 are male, 103 are female. The youngest is a 3-month-old infant, the oldest is 90 years. In terms of distribution by counties, Nairobi leads with 112 cases, Uasin Gishu with 30, Mombasa 29, Nakuru 25, Busia 24, Kisii 21, Kisumu 19, Kakamega 8, Murang'a 8, Kilifi 6, Laikipia, Kiambu, Embu 5 cases each, Homa Bay 4, Trans Nzoia and Turkana 3 cases each, Machakos, Isiolo, Kajiado 2 cases each, Nyandarua, Garissa, Tharaka Nithi, Vihiga and Kirinyaga 1 case each. I will go through the sub-county distribution for Nairobi, which recorded 112 cases, These come from Kibra 18, Westlands 14, Starehe 13, Langata 12, Roysambu 11, Dagoretti North 7, Embakasi East, Embakasi South, and Makadara 5 cases each. Kamkunji and Kasarani 4 cases each. Dagoretti South and Ruaraka 3 cases each. Embakasi Central, Embakasi North, Embakasi West, and Madare 2 cases each. The rest of the sub-county distribution is in the document that you will receive. So, on a positive note, today 243 people have recovered from the disease. 132 from the home-based care program, and 111 have been discharged from various hospitals where they were receiving care. This brings our total recoveries now to 31,340. And I want to take this opportunity once more to thank our healthcare workers for the good work they are doing that has enabled us to achieve these results. Sadly, at the same time, we have lost another 10 patients to the disease, bringing our fatality to 787. Once again, our sincere condolences go to the families and friends of those who have lost their loved ones. Asanteni, and I think we can now move on to the question and answer session. And I hope, as I said earlier, that most of your questions will be in the area of cancer. Thank you.
Good afternoon. Good afternoon. My name is Purity Musel from KBC. Before I get to my question on cancer, allow me to ask you a question on COVID-19.
Sure.
On the issue of reinfections, are we still relying on herd immunity? Because yesterday WHO ruled out the issue of herd immunity. So as the minister, are you following up on whether there are reinfections going on? And number two, is the country really following the advice by a scientist on what has worked for other countries in terms of the social distancing and putting on the masks? Or are we put down our guards? Maybe you can let us know about that. Then on cancer, most of the deaths that have been reported since March, the ministry had said that most of them are people with underlying conditions. I would love to know how many cancer patients have been infected with COVID-19 and the response to that, to the infection.
Thank you. Yes. Good afternoon. My name is Duncan. I'm with Reuters, the news agency. My two questions are on the COVAX initiative, which I believe the government of Kenya is a party to. Are you aware whether any adversities that might arise out of the potential vaccines that might come out of these will be shouldered by the government of Kenya, or are governments negotiating within that framework to establish some sort of liability clauses for the vaccine makers? Thank you.
Good afternoon. My name is Gagina with Switch TV. My first question, we just reopened schools. God forbid, but should the numbers spike, does the ministry or rather the government have a plan in terms of the students? Secondly, in light of COVID-19, the NCDs, non-communicable diseases, how is the state of the healthcare in Kenya in light of COVID-19?
Yes.
Sada Hassan, Standard Group. My question is on children that is resuming schools. In case a child tests positive for the virus, where exactly are they supposed to be tested from? That is now when children are reporting in case one feels maybe they're likely to be having the virus, where are they likely to get tested from? And then also the second question is on, last week you mentioned we are supposed to receive reagents into the country. Do we have the reagents right now in the country? And can you explain why we are having a sudden increase in the number of deaths over the last 2 weeks here in the country?
The last one.
I'm Haimba from Ebro TV. Waziri, maybe I would just like to know how many cancer patients have we lost for the last 7 months so far, and at the same time they were suffering from COVID-19. And then as the schools reopened yesterday, we saw some sort of funny things. I don't know whether it's sort of funny because is fumigation of the students part of the measures against COVID-19? Kente.
Okay, thank you. Purity, KBC. Reinfections. I think those of us who follow the literature, this is an area that not a great deal is known about. The whole subject of immunity and lasting immunity, how long this immunity lasts when one is infected and recovers from the COVID-19 disease, I think is a subject of intense inquiry all over the world. We're not sure whether this immunity actually lasts for long enough to be able to protect someone from a reinfection. There have also been reported cases of reinfection, by the way, and I've heard that we have also observed reinfections in our country as well. So, with respect to herd immunity, still nothing is known about that. I think as we move along and we continue to generate more information, I'm certain that we will get a good feel for the epidemiology of this disease, the immunity that it evokes, how strong that immunity is, what type of immunity it is, how long it lasts. These are questions that are still out there. And because of that, and because of the possibility of reinfection, it means we cannot, and many countries who had in the beginning felt that they could ride this pandemic wave by allowing herd immunity to develop, very soon realized that that was not working and they had to go back and institute certain measures. We as a country have instituted measures. We believe that these measures have played a big role in keeping us where we are today on our curve. And we need to continue to maintain those measures. We need to continue to maintain them even as we are relaxing some of the earlier measures that were put in place. We need to heighten adherence to those measures because that is one of the sure ways that we can prevent the transmission of the virus. Have we stuck to scientific advice? Yes, there's a lot of scientific evidence out there now that points to the fact that wearing masks plays a role in breaking the transmission of the virus, the hand washing, all the measures that we have put in place. I want to appeal to Kenyans that we should not relent on applying these measures. The simple measures which we as individuals can do and are responsible for, the hand washing, the wearing of the masks, the keeping social distance, the avoidance of public gatherings of any nature, those are within our control, and we need to be able to continue to do that to contain this virus. The number of cancer deaths that were associated with the number of deaths, COVID-19 deaths that were associated with an underlying cancer condition, I think that data we have. I don't have it on my fingertips. I don't think Dr. Kuria either has it, but we have it in our database. And we can pull that information out. I know that has been asked by two of the journalists here. We will endeavor to put that together and present it to you. But in general, what I can say is that in terms of underlying COVID conditions that are associated with COVID-19 deaths, we find that I think cardiovascular disease, diabetes and cardiovascular disease are the most common ones. There have been cases of cancer along the line and other non-communicable diseases. So clearly, if you have a non-communicable disease, you are at a higher risk of moving into the severe and critical phases of this disease with the possibility of death. Duncan from Reuters, this COVAX discussion is ongoing. As you know, COVAX is a discussion led by the Global Alliance for Vaccine Initiative. The idea being able to position countries from low and middle income countries in that queue of being able to get a vaccine if it becomes available and get it either free or at an affordable cost. Those discussions are ongoing. Whether these vaccines will have any adverse reactions once they are deployed to the market, I think that is usually taken care of by the rigors of the clinical trial procedures that it goes through, which is the reason why there has been a lot of debate about fast-tracking the process of authorizing vaccines to appear on the market. I don't think that any country wants to take those shortcuts, because that is when you will not be certain whether you have actually unearthed all the major adverse reactions that could play themselves out once you apply this vaccine to the general population. So we believe that the rigors of the clinical trial protocols will ensure that most of the adverse reactions will have been known by that time, and that only candidates that do not have these adverse reactions will be able to move through the process to be allowed market authorization and use in the public. So the negotiations are really largely at the point of what would these vaccines cost these countries? Would it be part of that Global Alliance vaccine initiative where funds are raised from some of the other donors and then they are applied toward providing vaccines towards those countries that are not in a position to afford these vaccines? So as I said, those discussions are underway. Schools. What do we do if we find that our transmission of the virus is increasing because schools have been opened? Well, we hope we don't get to that position, but it is a likelihood that it can happen. A second wave is a real likelihood for us. I think the data, as we have seen coming in, and we need to watch it very carefully over the next few days and weeks, is that we are beginning to see another steady climb following the relaxations. For instance, you can note that today our positivity rate was 12 point something. These positivity rates may fluctuate over time, but when we look at the 7-day moving average, and then we begin to see that we are moving above the 5% positivity rate, it's a danger sign that we are moving in the wrong direction. And to avoid moving in that wrong direction, we need to be able to strictly adhere to these measures, avoid public gatherings. Public gatherings are one of the biggest sources of infection of any nature, whether it is social, political, entertainment, or so on. So we will have to face it. If we find that the numbers are rising and are unmanageable, we will have to take action to restrict movements, perhaps even go back. It is a possibility that we could go back to closing schools if we see that. However, one of the things that is coming out from a lot of work that has been done outside is that especially the primary and secondary schools, the risks of children spreading, as taught earlier, is not as bad as was considered before. So we will have to closely monitor what's happening in our schools and then take the appropriate action as we deem it fit at that time. I think I answered the issue about comorbidities together with COVID-19 and the data that we shall compile and provide. If a child turns positive in a school or a child has symptoms of COVID-19, what happens? I think the protocols are very clear in terms of symptoms. If a person is symptomatic and the symptoms have been defined, the cough, the fever, the shortness of breath, and so on, then by now I think almost everybody knows those key symptoms, and there are procedures then of channeling that individual or child to a healthcare facility to be able to determine whether those symptoms are actually due to COVID-19, something else. So a test would be done. If it's a public facility, a test would be done. Of course, we have the rapid response teams throughout the country who would be activated to come and take care of that individual. The danger lies in the asymptomatic cases where there are no symptoms at all, and you will not know who is shedding viruses and spreading unless you do some level of testing. So I think going forward, some of the things that we will be discussing is to monitor, how do we monitor the situation in schools where we have large numbers of students? How do we monitor? I think definitely we will require to be doing some level of testing in those populations to see whether there is transmission of asymptomatic cases. Test reagents. In one of my briefings, I think it was last week, when we were at very low numbers, I had stated that we had just received a large consignment of test kits. That is why you have seen our numbers pick up in the last couple of days. So we do have sufficient reagents now that we believe will take us through the next quarter. And we also have arrangements to refill that supply line during this period. But I will not say that we will not experience any further breaks in the supply chain, because this is something that happens and happens everywhere because of the high demand of these commodities for testing globally. Number of cancer patients. Hayamba, your question was number of cancer patients. I think I have responded to that. And then you also raised the issue about schools now being open. I actually saw that clip on WhatsApp where children were being fumigated. That is not something the ministry recommends. Remember, when the pandemic started, there were efforts by the counties and many other institutions to put up spray booths, which were doing the same thing. We came out and we said, no, those things are not supposed to be applied on human beings. Maybe surfaces, but not on human beings. We stopped that. And I think this one too, I know that our officers have noted it and are taking action to advise schools that something like that is not acceptable, to spray children with fumigants on their bodies, on their clothes and skin. So we are aware of that and we are taking action. I think that is the end of the questions that I was asked. If you now want to ask the experts here anything on cancer, I think they are the ones who can answer you on that. Thank you.